Hey you guys, welcome back to another Miseducated Rambler video. My name is Bulani Dube, but YouTube prefers to call me Miseducated Rambler. So welcome. Did you know that nearly 2/3 of all women will experience fibroids, with Black women experiencing them at a higher rate? More than 80% of Black women experience or develop fibroids by age 50, and their experience is way more severe. They develop them at an early age, and overall, their lives are disrupted. Their daily activities are disrupted because of fibroids. This is part 2 of the Getting to Know Fibroids series. So in today's video, we're talking symptoms, the things that you should look out for, or what people with fibroids experience. Okay, so one of the symptoms would be heavy periods, heavy menstrual bleeding. Okay, one thing to note is heavy might mean different things to different women. So my heavy wouldn't be your heavy wouldn't be my heavy, and that's in the case of normal menstrual period, right? What it would look like for fibroids is you would maybe see that you're soaking through your pad and your tampon every hour. So you're having to change your pad or your tampon every hour for several consecutive hours. So that means you're changing every single hour, right? Another thing that you would look out for, or what you would see, is some women have their periods for like up to 7 or more days. Another sign that will show you that you're experiencing heavy bleeding is when you're having to double up or triple up on the protection. So where you're using a tampon, a pad, sometimes a cloth, sometimes nappies to, avoid leaking. And leaking is also another sign where you just unexpectedly find that you have messed up where you've been sitting, right? So you've messed up your clothes and all of that. Another sign would be, the people that actually cancel dates, cancel going out, cancel events because of just how disruptive and how inconveniencing it can be, to have such heavy bleeding. Yeah. And then another way to know if you're having heavy bleeding is if you are experiencing clots, right? Clots that are larger than or as big as a quarter. So to reference that, if you're in Botswana, you know the size of the 10 thebe. So the size of the 10 thebe would be a quarter, or the diameter of the 10 thebe would be a quarter. Okay, so yeah. And when it comes to changing the pads, for those of you that are wondering, on average, you should be changing your pad 3 to 7 times in a day, right? Or 4 to 7 hours, right? Yeah, 4 to 7 hours, 4 to 6 hours. And when you have to wake up in the middle of the night, over and over again to change the pad. So the submucosal fibroids are the ones that have been proven to be more prone to causing this heavy bleeding because of where they're located. Remember that they're located just in the lining, in the endometrium, right? So as they grow, as they bulge into the uterine, they are increasing the surface area of the uterine, or they are increasing the space in the uterine, right? So when you're on your period, when you're in your menses, that would mean that there is more tissue that is having to be shed, and therefore you'd have more blood, right? And then the other reason is that as they grow, they disrupt certain mechanisms, that is the clotting mechanisms. And these clotting mechanisms are the ones that help to regulate blood flow. So if that happens, then there's more blood being released. The other symptom associated with fibroids is pelvic pain. So women with fibroids have reported experiencing a deep, dull ache or pressure or a sudden sharp pain in the pelvic area, right? So this is usually the case, especially when the fibroids are large or they are pressing against like the surrounding organs. The pain may worsen during your period, after standing for a very long time, during sexual activity, or even while you're resting. And the fibroids associated with this particular symptom mostly, not that the others are not, but mostly it's the subserosal fibroids because of where they're located. Remember that these ones are located in the muscle, right? In the muscle that is surrounding the uterine, so the outer side. Yeah, so those ones will be more closer to the pelvic area, to the surrounding organs, and all of that. The other symptom is frequent urination. So, where you find a person is having to go to the bathroom more than 8 times in a day, where on in a normal situation, a person would go 4 to 8 times per day, right? And only needing to go once in the night. Whereas with fibroids, you would maybe be waking up more than twice, more than 2 times in the night. So this happens because as the fibroids get bigger, they go impose onto the bladder. They put pressure on the bladder, and then the bladder is not able to keep the capacity that it would normally be able to hold. Okay, so it wouldn't be able to hold as much urine as usual. Okay, so also, some women would experience like that urge to pee that they cannot ignore. Like, usually you're able to hold your pee, maybe you're in a meeting, you're able to hold it for a couple of minutes and then you can go. But like with this situation, like the urge is there and you just cannot ignore, so you have to go to the bathroom, right? The other one is that irritating feeling where you still have pee left, but you're peeing and you can tell that your bladder is not fully empty. So yeah, that's just a couple of things that is associated with this symptom. Another sign is experiencing pain during sex, right? So this will depend on the location and the size of the fibroid. So fibroids that are near the cervix. So the cervix is okay, so this would be the vagina, the opening of the vagina, right? And then the cervix is a day. So if there's a fibroid near the cervix, then during sex you would experience a lot of irritation and sometimes um, bleeding can follow. Another symptom that women with fibroids experience is fertility problems, right? Um, a lot of women struggle to have babies because of fibroids. And this happens because some fibroids are located like near the fallopian tubes, right? So when they grow, become big, they can end up blocking the fallopian tubes. And the fallopian tubes, if you know, these are the passageway for the egg, right, that needs to come down and get fertilized by the sperm. So if that passage is blocked, that means the eggs are not traveling down to get fertilized. Okay, so that's one scenario, one example. And then another situation is with fibroids that are like disturbing the uterine lining. So as they grow, the uterine is made up of, it's vascularized, meaning there are veins, there's blood supply there. So when these fibroids grow, they can disturb the blood supply that is going on, even cutting it off. So if an egg wants to an embryo wants to implant itself onto the wall, it cannot stick onto the wall because there's no blood there that it needs to help it do that because of the fibroids. And so, obviously, the fibroids that are the culprits for this type of problem are the submucosal and the intramural fibroids, right? With the submucosal being the bigger culprit. The subserosal is not very much because of how far they are from the uterine line, right? Yeah. So there are cases where symptoms are not experienced at all, right? And that is largely because of the size of the fibroid. I think we've already noticed just how impactful the size of the fibroid can be, right? So the size, the location, and the number of fibroids that are there in the uterine affects the symptoms, okay? The submucosal fibroids, these are the most disruptive fibroids, when we're talking symptoms. So their behavior is largely influenced by just how deep embedded they are in the lining. Okay, so what I mean by that is if less than 50% of the submucosal fibroid, less than 50% of it is deeply embedded, and it's not like protruding out into the uterine, then it's less likely that you would experience symptoms, right? So if 50% of that fibroid, less than 50% of it, of the volume, is protruding into the uterine, then it means that you're not going to experience any symptoms, because that means they're not big enough, right? So if they are, then that would mean that there's the symptoms, there's the pain, there's the bleeding, and all of that. So if you found this video helpful, please do not forget to drop a like and to comment anything in the comment section that has to do with fibroids, any questions that you might have, and please subscribe to my channel. I'm going to make another video again on fibroids. We're still going with the fibroid series, so stay tuned for that. Thank you once again for watching. Until next time, bye.